All right, thank you everyone for joining us today. We're very excited to have our webinar. A couple housekeeping things to get sorted first before we begin. You will notice that we have muted everyone's audio for the best audio experience. If you have questions as we're going through the presentation, please use the Q&A option. Across your Zoom bar, you'll see a couple different options. You can use the chat button to kind of chat with people, and you can feel free to chat in where you're joining us from. If you have questions for our panelists, please use that Q&A, and we will either answer them as we go along, or we will save them for the end when we go through our Q&A, and we'll do our best to answer as many questions as we can. A couple other things before we get started. We do have a survey at the end of our webinar. So please make sure you stay till the end. We will be providing a link to a survey, and you will be entered to win a $50 Amazon gift card when you complete it. Other than that, we'll go ahead and get started. Here are our leaders who are joining you this week for our webinar. We have Jessica Langley-Lepp, who is the Executive Director of Health Science Education and Advocacy at the National Health Career Association. We have Jake Gleghorn, who's our Chief Strategy Officer at the New Orleans Career Center. And we have Jenna Lloyd-Fisher, who is the VP of Clinical Excellence at Ascend Learning. So Jessica, I will hand it over to you and let you go ahead and get started.
Oh, thank you so much. Super happy to be here, everyone. Thank you for joining us. We still have people coming in the room, so that's great. But we will go ahead and get started today. I am going to have our other leaders that have joined us today do a brief introduction of themselves. Most of you know who I am. I have been with NHA for the past 10 years, representing the organization on efforts around allied health education, training, certification, workforce development, and regulation across the country. I am a clinician by trade, and I have held industry certifications for over 20 years to age myself. And I have worked alongside physicians and educator leaders and workforce transformationists, and all really to hopefully boost the efforts of delivering high quality patient care. So we're happy that you guys are here. I am going to have Jake introduce himself and let him know what he does in his role with New Orleans Career Center.
Sure. Thank you, Jessica. Hi, everyone. My name is Jake Gleghorn. I am the Chief Strategy Officer of the New Orleans Career Center. We are an independent nonprofit technical training provider for New Orleans public high school students and for underemployed and unemployed adults in our city. We were founded in 2017 to give advanced career preparation and technical training to members of our community. And we design pathways specifically focused on high quality training in our local economy and with local industry demand. So the programs that we build have clear sightlines to careers and that graduates can grow in, support families with, and have prosperous futures. So we work directly in response to industry and community demand. We've also developed for-hire training programs. And I do a lot of the advocacy and strategic planning work at the Career Center and work closely with the instructional team. I'm a career educator and have worked in a number of schools and different organizations that are focused on education and ensuring equitable access to resources as well as opportunities in New Orleans.
Wonderful. Thank you so much for being here. What a great background. And I am very excited to highlight NOCC and the organization around how you guys are being innovative in this space in terms of really seeking out individuals to train for high demand areas. Next, we have Jenna Fisher. She is the VP of Clinical Excellence for Ascend Learning. And I'm going to have her introduce herself as well and provide her credentials and background.
Yeah, it's great to be here today. I have been with Ascend Learning since August of 2022. I have over 20 years of experience in healthcare, both spanning academia and practice, more recently serving as Chief Nurse Informatics Officer and overseeing not just the technology side of the practice, but also all the clinical education for the healthcare system and a clinical excellence role. Had the opportunity to really work here at Ascend to spend a lot more time researching this particular market and understanding strategically what this market needs, what our customers need in this market to support the roles that they are hiring for, and to really provide that ongoing support, not just for a student in academia, but also as that student moves into the practice side, either through certification or licensure. So very excited to be here with you today.
Wonderful. And yes, thank you so much for your vast knowledge in representing the healthcare workforce space. You'll be able to share quite a few insights with our group today. All right, so let's jump in. We are seeing the agenda slide, which is wonderful. These are the key areas that we're going to talk about today. We're going to set the stage just a little bit around some key insights and trends, and then focus on the area of transferable healthcare skills. This has lots of names, and we'll kind of dig into that and understand why this area of having durable, transferable professional skills is so important. Then we are going to look at a couple of specific examples of training programs and key partnerships that have been successful in searching out this talent. And then we'll also talk about how we can leverage these skills with individuals and really help them do career advancement and find pathway opportunities for advancement within their current roles. So lots to cover today. So let's get going. We go to the next slide. Are going to talk a little bit about the need for healthcare talent. So we're going to start by asking a poll of the audience to gauge the audience's need in terms of where does healthcare talent, exist across, or what's the status of healthcare talent in your organization? So what's the current state of your frontline healthcare workforce? Do you have a strong pipeline? Is it good or above average and only have a few open positions? Is your pipeline low and you're really looking at different strategies to strengthen the numbers that are applying or that you have to choose from? Or we have high needs to fill many in-demand roles. So if you guys could click that choice, just one, if you don't mind, best describing how your talent pipeline looks right now for your organization. And Helen, you maybe have to share the percentages or the results with the group, if you don't mind.
Sure, I will share the results once everyone's done voting. We have about a little more than half of our votes in.
Great.
We'll give it another minute and then end the poll. And for those of you who are chatting in, thank you for using the chat. Please make sure to switch to messaging everyone so everyone can see your messages if you are chatting in where you're joining us from. And I'm going to go ahead and end the poll in just a second.
Wonderful. All right. Well, a little surprising, but also positive. So this is great to see that we do have 27% that feel like they're in a pretty good position in terms of talent. 39% say that they're low, and I think that's probably where we expected the majority of the group to be, knowing that they're always looking for new and innovative ways to fill that pipeline. And then we do have 24% of our audience today that is looking to fill many in-demand roles. So hopefully there will be some key takeaways for the group on this today. All right, let's move to the next slide and talk a little bit about the insights and trends that are resulting in the reasons why you answered the way you did on the poll. Let's talk about the why around the topic, and it's very top of mind to healthcare leaders across the country, and it continues to make headlines. These are just a couple of them that I pulled from across the country. talking about our national shortage, the crisis, and the demand for talent. 3.2 million predicted shortage of healthcare workers, and that's cumulative. So physicians, nurses, and allied health. That's pretty big in just a short amount of time, knowing that 2026 is right around the corner. We also see that over 100 million Americans are lacking access to regular care right now. And it's predicted that this will get worse based on the shortages that we are estimating. So definitely something to keep an eye on in terms of the availability of care for and within our communities. And then another staggering percentage is 47% of workers plan to leave their current role within the next 2 to 3 years. And that's due to a number of issues. It could be because of retirement. It could be that they are experiencing some burnout, etc. But for various reasons, we're pushing that almost half think that they will be leaving the role in a couple of years, which is just going to add to the ongoing issues that we're seeing today. There was also a new report that came out from the American College of Healthcare Executives that states that the workforce shortage topped the list for CEOs at large health systems across the country, saying it's the biggest area of concern for them. And they identified that at 87%. So that's pretty high. And it's actually topped the list for the 3rd year in a row. So our leaders in the healthcare space are staying up at night, worrying about where they're going to find talent for tomorrow. It doesn't help when we see a turnover of essential allied health positions at a rate of 26%. And then since 2020, we've also had 1 in 5 frontline healthcare workers leave their jobs. So that's about 26% of workers in the allied healthcare space quit in 2023 alone. So again, not real positive numbers for us. These recent data points really paint a concerning picture for us. Many are, again, feeling burnt out, things like that. Now, a little on the positive side, we did add 72,000 new jobs in the last month or so, which is outpacing the monthly average, which tends to be around 60,000 new jobs over a 12-month period. So healthcare is leading all sectors for job growth. So that is a wonderful positive mark to think about as we start to move forward. So not all doom and gloom. We are increasing those jobs, but we do have a lot of areas that we need to make sure that we focus on. For our discussion today, I want to highlight one specific allied health profession. Our health systems are really struggling to find patient care technicians. So patient care techs, or PCTs, their turnover has reached a staggering 32% in 2023, which exceeds the national turnover average for across all professions. So definitely something to think about. The loss of PCTs have an impact on other areas of the care that we deliver. It gives risk to the quality of patient care amidst our growing aging population that is putting a higher demand on us for delivering care across the system. I wanted to note that California is really grappling with this severe shortage of healthcare frontline workers, particularly patient care technicians. And they indicate in their state alone, they have a potential deficit of around 600,000, all the way up to 3.2 million allied healthcare workers by 2030. So they're dealing with their own level of crisis in itself within that state, but just an example of the impact that patient care technicians have just in one condensed area. We also know that 83% of our workers are reporting that they're experiencing severely understaffed departments. That leads to high burnout. 74% of patient care technicians say that they lack the proper time needed to care for the patients in the way that they would like to. And then another 65% of healthcare workers have witnessed delayed in care or denying of care due to staffing shortages. So this just goes to show that the percentages that we talked about and the issues presented in the previous slide are in fact leading to deficits in how we are delivering care to our loved ones, to those in our communities, and really supports the need for us to look for talent in a variety of ways. All right, so we're going to jump into this first area, which is around the transferable healthcare skills. And again, I know I mentioned that we use those words in a variety of ways, right? Soft skills, professional skills, essential skills, transferable. The new keyword I feel like in 2024 is durable skills. So if we move to the next slide, we are going to look at how we are bringing hospitality to healthcare. And we're going to focus on the skills that we see primarily that individuals working in the hospitality industry possess and how they can transfer those into the healthcare space. Because of the severe worker shortage, we've been forced to think kind of outside of the box and be innovative about how we are educating and training individuals. The career success pathway, or like healthcare pathway or healthcare highway, which you can kind of see a really great infographic here that we've developed. We think that it's traditionally gone towards just higher education. That's the natural path that people take in order to enter a career into healthcare or many other fields or industries. But actually, we are seeing that we're sourcing and training individuals differently. More so going through what we're calling a non-degree pathway. We're seeing that pathway grow, and it's starting as early as in high school with our career and tech ed programs. Many students are engaging in that and actually being able to acquire frontline healthcare skills and certifications so they can either go right to work or continue towards that traditional higher education path. Although outside of the traditional path, we are seeing that 70 million workers are being skilled through what we call our alternative routes. And that's based on some research done by an organization called Opportunity at Work. And essentially what that means is those individuals, when we say they're skilled through alternative routes, that means they don't hold a bachelor's degree, but they're active in the workforce. They have a high school diploma and are 25 years or older, and are probably doing some sort of skills-based training in order to stay current or to get jobs. One way they're doing this, as I mentioned, is through career and tech ed or career centers, just like NOCC, and that Jake's gonna talk about here in just a second. And these non-degree pathways really focus on knowledge and skills. There's some non-degree pathways like certification programs, boot camps, apprenticeship, competency-based learning credentials. All of these can be a solution that bridges the employer's needs to connect with students and learners and to get them to work. The other thing to note is that our younger learners, especially our Gen Z, they're more interested in faster ways of becoming up to speed in terms of learning. They are more economical. They want on and off ramps, and they want to be really engaged in meaningful careers, which means they want to do something that they really have a passion for. So guiding them even earlier in high school is a really great way to kind of capture them or connect them to some of those passions that they find. In order to achieve this career success, we've, traditionally focused on learners needing to engage in hard skills, right? The skills that they need to perform a specific role. But when we've gone back and looked, there's only about 15% of job success that really lies in mastering the hard skills. So in this case, we may be thinking about clinical skills, doing vital signs or phlebotomy, things like that. But really, it's the transferable skills that demonstrate their ability to critically think, to collaborate, work in teams, possess leadership, and that constitutes for 85% of what employers are really looking for in terms of job success. Therefore, we really need to look on how do we factor in the strengths and aptitudes of individuals into our hiring processes, into our admissions processes, things like that, so that we can focus on those strengths and aptitudes, and it ends up being a win-win for everyone. Not only the employers that are looking to hire, but the individuals themselves that are being open to opportunities to learn and to go to work. So the concept around durable or transferable skills isn't new. We've been talking about it. It's just there's a stronger need to maximize individuals with these strong set of skills and transfer them into the high demand roles, especially within healthcare, and then more easily train them on the hard skills. So with that, I want to ask Jake to kind of weigh in here for a second. And before we get to the poll question, as a leader within a career center, Jake, can you share with the audience what are some various pathways in which learners enter into your organization and the role that those durable or transferable skills play as a part of your general curriculum or kind of overall course content?
Sure, Jessica, thank you. First, pathways that learners enter our organization through. We work very closely with the school district and enroll high schoolers for half-day, everyday technical training. And that is one big part of how participants enter our program. This is more focused on career exploration. We have almost all of our healthcare trainees, what we call them, go into healthcare as an industry or healthcare training and higher education after us. About 60% of our young people actually end up going to college or university after us. However, we also have pathways where if you're unemployed, if you have just graduated but aren't sure what your next step is, we have those train for hire and programs that are really more focused on going directly into the workforce. So once you find yourself at the Career Center, you're going to see that durable skills, transferable skills, employability skills play a huge part of our curriculum, while all of our trainings map towards a nationally recognized industry-based credential. Multiple in the in the healthcare pathway actually focus on NHA credentials, like patient care tech and like medical assisting. You find that that is woven in. So all of our instructors have done the jobs that they're training for in industry. And so not only does it come through in the ways that they are actually tying the content with what it would look like in industry and their personal experience, it also plays into skills checkoffs. It also plays into them understanding and being able to translate what are skills that they have and that they've brought into what that might look like in a job scenario. So really being able to call that conscientiousness customer focus, or really being able to name the communication skill of proactive communication and allowing that to shine through on an email. And so there's really multi-tiers and also different program teams and instructional teams. For example, work-based learning, transition, and that employability work-based actual technical training piece with that medical assisting instructor, that pre-nursing instructor, that pulls that through and makes that thread throughout, where it's not just technical training, it's really job training.
Great to hear that it has such a strong focus in the curriculum and across, different programs being naturally implemented. I think we're seeing a lot of that. All right, so Jake shared how a number of skills are often found individuals working in other areas, such as hospitality, can be used as a foundation for healthcare. Let's find out a little bit more from our audience. There's going to be another poll question pop up here. Which of these durable or transferable skills is found to be most important to you all in healthcare? So those of you working in healthcare, which transferable skill do you feel like is the most important? And I know it will be hard because all of these are good ones to have. But which ones do you think are most important in healthcare? And here in a few slides, we're going to share some charts of how job postings rank these, and then also how some larger organizations across the country rank some of these skill sets as well. So we'll see if they align. Give it just another minute. Right, here we go. Okay. Critical thinking and problem solving has kind of a landslide victory here, which is great. I do think when we think about the allied health area, that is really important to have those assets along with communication being number 2. Right, great. So we'll close out of that. And we will move into the transferable skills that are applicable in healthcare. So we want to really think about the importance that they have in this space. As we move towards recognizing and integrating durable skills into the workforce, it's more than just adopting a new tool or an assessment. It really is a fundamental shift in how we approach talent development and retention. So the durable skills are high demand, are seen in a lot of high demand jobs across different industry sectors, geography, educational levels, often, eclipsing demand for sought after technical skills. So like we mentioned before, that kind of 85 to 15% comparison of what employers are looking for. When we think about aptitude and kind of that hiring mechanism, right? We are looking at the durable skills, and as you can see there, they actually appear almost 5 times more often than the hard skills. So that really goes back to show that 85-15 split is really something that we're seeing. What we also see is a large percentage of them in terms of job postings also focus on durable skills. So 7 out of 10, again, employers are seeking them nearly 4 times more. And then we also think about automation. We're worried about AI and the introduction of AI into healthcare, but AI is never going to be able to replace the human, sense of those skills. So even if we're worried about that, an individual who has really great and demonstrates a high level of durable skills, that's going to be considered a strength as we move into this new kind of digital age. So, all right. Here on the next slide is those charts that I was talking about. So if you look to the one on the left, this is a number of job postings that actually list one of the durable skills as a keyword. So you can see communication there is over 22 million times, which is incredible. And then they kind of go down: customer service, management, leadership being some of the top ones. And then on the right side, there are some national organizations listed there: Jobs for the Future, Center for Curriculum, Redesign, MZ kind of was a Burning Glass partner. And you can kind of see which ones come out on top there in terms of the competencies. Communication is still, leading. I see critical thinking being in the top, couple, again, with leadership, teamwork, but definitely communication kind of topping out across both of these charts. So I think that's a great piece of research or tool to have. All right, now, when we talk about this, there's a big component of maximizing an individual's skills or their durable skills, but it's also very important to know how do we have to be able to evaluate and assess those, right? In order to understand where that person may be more successful. So I'm going to take 2 minutes here to share a tool that helps do that. It's called Personability. It helps students and employees effectively build essential soft skills and drive different behavior changes using a unique process that utilizes learning and assessments through virtual simulation. So kind of an AI component here. And you can kind of see the different areas that this particular product looks at. Decision-making, communication, teamwork, active listening, emotional intelligence, empathy and compassion, all of those being very important, obviously, to the field of healthcare. It's a very interactive tool that allows individuals to practice in a safe space and then also assess those individuals as they work through the different simulations. They engage content on those soft skills that blends with the academic kind of educational setting and introduces them to use those in the real world. So you can kind of see here a couple of different percentages. 93% of the employers feel that professionals don't have the adequate training needed in soft skills. So this is a great way to boost that percentage within your students before they go into the world of work. 67% of hiring managers say they would hire a candidate with strong soft skills. So again, there we go. And 53% of patients said that healthcare systems generally provide compassionate care. So that number is great, but we would obviously love to see that to be even higher than it is. All right, we are going to transition into sharing with you some industry examples and best practices around durable skills, how they're used as a foundation for specific training initiatives and individual successes. So the first one that we are going to look at is going to really focus on the work that Jake has been doing. And NOCC was part of an exciting initiative that was actually called Hospitality to Healthcare, in partner with a couple of large employer partners in your area. Can you walk us through the details of this initiative, kind of how it came about and what some of those outcomes were?
Sure, happy to. Thanks, Jessica. So in early 2020, the pandemic brought a significant amount of layoffs to the hospitality industry based on local 23 union data in New Orleans, and commensurate with 50% of the workforce was laid off within only a few months. And this disproportionately impacted Black New Orleanians, as the city is mostly Black, and a lot of those positions that were eliminated were those held by Black workers. And this not only created an urgent need within the community, it also created an urgent workforce need. At the same time, there was a lot of healthcare strain on the hospital systems, and so an increase for clinical health workers. And so during that time, our training, which was focused entirely on high school students at the time, we had an urgent community need, and we were approached by a local hospital system, the largest in our area, called Ochsner Health, and they had the need for some certified, qualified PCTs quickly. And so at that time, we were really looking at our own staff and our own training program and what was happening to it, and had the need or had the capacity to actually develop a rapid training. And so one important piece about our partnership is there was co-design of the training from the beginning. And that's something that I just want to encourage those that are thinking about similar partnerships to really make sure that they build in, and both partners at the table really thinking about, okay, what do we need to get done? What can we do in terms of onboarding and their normal workforce processes, as well as what key skills need to be woven in beyond just getting that industry-based certification for PCT. And so out of this urgent need became the opportunity for a partnership, one that was different from what we had done, had trained for hire, had that employer partner at the table really as a collaborator and a thinker in addressing what was an urgent need for both of us. So really, part of what NOCC does is our value of partnerships, and whatever I share today, I want to make clear that this was not done in a vacuum, and this was not done just by the Career Center. This was done in collaboration with the community, and that really means across. And so JFF has this concept of the big blur, and so really commenting to what Gen Z is asking for, as well as communities are asking for, and really being able to explore innovative solutions that allow training and employment to happen on quicker timelines with less and less cost. And so we forged these partnerships, and we provided high quality technical training, and the employer partner not only co-designed the programming for us, but also agreed to a guaranteed job interview and job placement on the other side, which is really important for program participants in terms of looking for stability in their life and looking to transfer their skills to another industry, and not just start at zero. And so really identifying those durable skills and bringing those into the training process and moving it through as quickly as possible.
We go to the
and I think there's, yep, great, thank you. And so just as far as some of the program details, this program is accelerated. It's a 8-week accelerated patient care tech program. And again, it focuses on unemployed or underemployed folks. At the beginning, that was exclusively hospitality, and we've really expanded that lens to those that are in need in collaboration with some of our community partners that we work with. And anyone passing the certification exam would be guaranteed a job interview, and really worked with community-based organizations that were doing stabilization and case management, through the American Job Center, through other community-based organizations, and for example, United Way, that then would match participants with us as a training provider. And so we see ourselves as a piece of an ecosystem that's incredibly important. And through this adult rapid reskill program is what we called it. We just graduated our 10th cohort. We have certified more than 240 patient care techs in our adult program only. And one of our healthcare partners actually said that we basically resolved all of their patient care tech shortage over the last few years. And so they really are seeing this as a key workforce strategy, especially for this entry-level role into their hospital system. And just a couple markers of continued success. We've had high certification rates for any program, but definitely one that works with folks that were previously unemployed or might be getting SNAP benefits. And then also really high rate of hires across our employer partners that we've worked with historically, both Auctioner Health and LCMC Health. And so proud to say that at the Career Center, we've certified 546 patient care techs and medical assistants since fall 2019. And we've certified 165 patient care techs and medical assistants across our high school and our adult training in just the last year. And so we are not just doing this in a small boutique way, but we are really finding some scale in our training programs, and really grateful to the partners that we've worked with, and most of all, the participants that have gone through our programs, who really deliver on their interests and transfer their skills, whether it's from hospitality or another industry, into their new profession.
Love those numbers. I'm sure everybody else likes to see that as well. I know you mentioned, if we go to the next slide, you mentioned the JFF report and kind of some of the initiatives that they're working on even today, but they did also look at a similar initiative of this hospitality to healthcare, and have a really good kind of research paper written on it that kind of walks through some of the key steps. I don't know if you wanted to speak just a minute to that as well.
Sure. So the report that Jessica speaks about is called From Crisis to Careers, Supporting Displaced Hospitality Workers in Tourism-Driven Economies. That definitely describes our economy in New Orleans, and especially historically. And so we worked with JFF as well as a number of other community partners in collaboration on this report, just to capture some of the competency mapping that we did do as part of the design for the training program. And so just to call out a few, and again, we've been talking about these durable skills and these transferable skills throughout the webinar so far, but problem solving, critical thinking, customer focus, communication, digital literacy. These are all things that hospitality workers already bring to the table, and not just, especially in a tourism economy that is as old and robust as New Orleans. They bring these to the table, and not just at an entry level, but they are in many ways masters of their craft within hospitality. And it's about capturing and allowing them and supporting them to translate some of those really not just entry level skills, but very developed competencies into what is very useful for healthcare as well. And so just to call that out, and thinking specifically about wait staff, hotel desk clerks, and even baggage porters, they already come in with a good amount of digital literacy, being able to use those different enterprise software systems in their companies that they already work in. And they're building on that and bringing that to healthcare, perhaps to a nursing assistant or a patient care tech role. And they're building on it and adding active listening. They're adding some of those technical skills. And they're also adding a greater sense or a greater level of reading comprehension. And so this report calls out direct competencies and how those have been mapped onto a variety of entry-level roles within healthcare that can enable and support employers to think about their hiring differently, to describe their roles slightly differently, and to bolster their workforce pipeline strategies to include others that they might not typically think have some of those skills that it takes to really become great healthcare workers and start their healthcare career. Because these shortages map directly onto a lot of the skills from industries that have less positions and less hires and job postings to share.
Wonderful. That's a great resource. Hopefully you guys will check that out. I want to take us next to share an individual's journey around her hospitality to healthcare kind of experience. So Quintisha was became a mother at 15 years old and started working at McDonald's in New Jersey. After working at McDonald's, she moved into a kind of a role within Purdue Farms where she was able to get some management or leadership experience. She was training and supervising other employees. She brought those skills back to McDonald's in 2011 and was hired into a manager role. And through McDonald's Archways to Opportunities program, they got her eligible to earn her high school diploma, which was amazing. Because that opens up so many doors for individuals just having that diploma. And then with that, she used some grant money from an area technical community college, Delaware Technical Community College, which is a partner of NHA's, and enrolled in their medical assisting program because she had always wanted to, serve others. And in just 4 months, she was able to complete the MA program, pass national certification exam, actually 2, one for both front office and back office, so an administrative assistant and a clinical medical assistant, and applied for a job at one of the local healthcare organizations in 2021 and started working there in 2022 and has been there ever since. I really love her story because it talks about her taking, the strengths that she had and building upon them. If you see here a couple of different, quotes from her, her journey wasn't an easy one, but everything that she went through made it worth it. She's excited to see where her skills take her next, without getting her diploma through the McDonald's program and without, the employer giving her a job after she completed her MA training. She doesn't know where she would have been. And she thinks that she loves this story the most because she modeled for her children as well. And now one of her sons is actually enrolled and attending nursing school. So I think just what a great story of just exactly what we're talking about, looking at individuals that come from maybe not the background you would think about that you would want in order to transition them into healthcare careers. But as you can see here, it's more than just flipping a burger and messing with fries. You learn a bunch of different aspects when you're in those careers that can be transferred over. So I love Quantisha's story there. Now we're going to transition to, we are going to transition over to Jenna. And I am going to have Jenna speak a little bit because her team is focused on working with healthcare systems and getting individuals trained faster, quicker, and able to deliver care quickly. And I know she has a couple of different areas she wants to talk about how her team supports kind of this notion of hospitality to healthcare and some of the solutions that her team is offering. So Jenna, I'll let you speak to this.
Okay, thanks, Jessica. So, what you've heard throughout this session is that there's a large need in this space from a pipeline standpoint, and it's going to take many, many different avenues in order to support that pipeline and to have an impact to the shortages that are occurring all across the U.S. when it comes to the healthcare needs and the healthcare worker needs. Our team really spent, we're going on 2 years now, talking to a variety of stakeholders in this space to really understand what is the problem to be solved for healthcare systems, for our ambulatory practices, for our different clinical settings when it comes to the pipeline. And really what we found is there was an opportunity to create programs that could be in place for the different clinical settings that could be delivered directly from those clinical settings, and work to develop out programs. You'll see the 3 there that we've developed for medical assistants, for patient care techs, for phlebotomy techs, and for new nurse hire orientation as well. So we really worked to determine what were the essential things that were needed within this healthcare space to orient and provide on-the-job training for entry-level roles like patient care tech, like MA, like phlebotomy, and developed out a framework, which I'll go over in the next slide, but developed out a framework to determine what would be the objectives of the program, what would be the competencies needed, and what activities did we need to have within our products to support that, and to put that into a ready-to-implement program, where essentially you have a standardized approach, whether you're a large healthcare system, a small facility, a part of a large integrated practice or not, really this ready-to-implement evidence-based program that can be provided by your healthcare team that prepares that new hire to go into entry-level roles like medical assistant, like patient care tech, like phlebotomy. So that's kind of the first product offering that we really, really focused in to understand what was needed in this space from an essentials perspective. The second piece of this is that to offer that certification through a career path and to support different career advancement opportunities within the organization to support those healthcare workers on their journey in that career path, as well as develop out also what we're seeing in the market is that there is a real desire to continue to develop the roles beyond just coming in at that entry level and staying there, really developing out a clinical professional development ladder for our allied health roles and for our nursing roles. So that professional ladder really promotes that professional growth with through a recognition and rewards program that our team really works with your teams to determine what is the criteria for that clinical ladder, and what is the length of time needed to really support, so that all of this is really centered around focusing and supporting recruitment and retention of your healthcare team. So we actually have a team of experts within our company that are clinical professional development board certified specialists that have worked to develop out these programs for you to deliver within your healthcare setting. And I'll ask you to focus down on the lower right-hand side of the screen at that wheel. And the way that we did this is we worked with several of the key stakeholders. So whether it was some of the chief executives, the chief nurse executives, the professional development teams themselves, the clinicians at the front line, providing direct care, to really determine what should go into these on-the-job training orientation programs. And they really do center around the patient-centered care, and they are informed by the things that are really critical to the healthcare practices. So regulatory, quality, and professionalism. And then we go further to inform those areas by things like the Joint Commission, like CMS, any of the state regulatory requirements that are in place for your states, and then focusing in on the quality and professionalism is one that we heard loud and clear every time we talked with different stakeholders, which is highlighted in the earlier part of this presentation, where what we were seeing was that there was a need to ensure that the education being provided was inclusive of things like soft skills, like conflict resolution, communication, being able to work with a healthcare team, because a lot of times these roles are educated in isolation of each other, and there's a need to understand how all the roles work together when you are truly working as a team in the healthcare system. So really thinking about how we work as a team as well. And then if there were professional standards that are in place around these different roles, integrating those into that orientation and on-the-job training. And so we have, a variety of things that you can see in the top right. But as Jessica talked about, personability is one of the things that we are sure to include, as well as simulated modules around communication and collaboration, because we saw very clearly that's a huge need. And so we've integrated kind of the best of our products, and we've added to the best of those products to make sure that we're bridging that gap of what is needed with the healthcare teams to support this workforce, where you can bring this into your organization. We do this alongside you, though. That team that I talked about, that clinical professional development team, works with you hand in hand to really determine how to implement this and integrate this into your workplace to allow you to be successful. So I'll turn it back to you, Jessica.
Thank you. What a great example of taking some of the foundational skills that they have along with the hard skills, putting it together and streamlining the process for employers or healthcare systems to do it quickly, which I think is great. Now we're going to quickly go through kind of career advancement and career pathways. So we have another poll question. I want to know, currently, skills are the currency that drives progress. How many of your organizations are putting a key focus on skills? And this one you can do multiple choice, but these are kind of some of the hot topics and buzzwords in 2024 around a skills-based economy. So are you guys focusing on skills gap, skills development, skills-based hiring, upskilling and reskilling? It's all about skills. So we'll see what the audience says here as we work our way through this and close out our session here in just a few minutes. Give everybody just a few more seconds here. Right, I think Helen's gonna show us the results. Here we go. Okay, so looks like our top two, skills development, upskilling and reskilling, which that makes sense because of the new focus on skills-based hiring is probably not as high demand practice yet. I will let you know to keep an eye on that though, because it is being talked about a lot. But okay, skills development and upskilling and reskilling, perfect. Okay, so let's go to the next slide. Where we are looking at focusing on skills development and the importance that it plays here. Just a second. We mentioned that skills is the big trend in 2024 and some of those buzzwords. And really, we're thinking that 80% of companies are shifting to this skills-based hiring model, and more plan to do that, you know, as it becomes even more popular. So as I mentioned, kind of keep an eye on that. We also feel like skills is being targeted because of the skills gaps that we're experiencing. They really think it's going to cause a problem on kind of, you know, business operations and things like that. We are seeing an uptick in 2023 versus previous years of leaders thinking that the skills gap is going to cause issues within their business. We also think and look at talent leaders in terms of that expected increase of competition for the hard skills and those individuals lacking the soft skills that we've been talking about. They think that's also going to be a top challenge. So that's where that upskilling and reskilling will come in. If they are deficient in the areas of durable or transferable skills, they'll be looking, you know, at particular tools and resources to get that to where it needs to be. And then using this skills-based practice can really help us solve the healthcare's staffing needs. Hopefully it will attract more workers to come into the space and encourage them through upskilling and reskilling, you know, to work in those roles and also create a culture where they feel safe and that they're valued and recognized for their work. All right, on career development and support, you want to go ahead? There we go. It's a major focus for employers. It's a big, when we talk about career development and support, it's a huge retention piece for employers. 70% of them are planning to create new hire, reskilling training programs or other training programs to address staffing needs. That's a pretty high percentage. And we know they also want to focus on that continuous learning piece. I feel like the gap, though, exists when employees or individuals aren't made aware of or aren't taking advantage of some of these efforts. So you can see here, you know, 40% know that their employers offer a tuition reimbursement assistance program, but 2% are actually participating. Or, you know, we know employers know that offering career laddering programs for their entry-level workers is a successful retention tool, but less than half are offering them within their institutions. So we've got to close those gaps on some of the best practices that we're already seeing. Again, focusing on using the transferable and durable skills as strengths, use their LMS to offer these learning opportunities to their employers. Jake already mentioned how the partnerships are key. And Jenna talked about how we kind of close the gap from that transition to practice by standardized onboarding and training. And then just thinking outside of the box through different models like apprenticeships and things like that. Next slide. All right, so as we kind of round this out, a couple of quick things here in terms of how to find and keep that talent. First one, again, open to finding and recruiting talent in things in areas that we haven't thought about before, right? These non-traditional areas and methods. Really recognizing the contribution and the value of our allied health workers. Let them have a voice, give them those opportunities to upskill or reskill. Have them be a part of your strategy development. You know, have them work on subcommittees or task force to improve processes and policies. Set your talent up to succeed again through those upskilling, career pathway, and career ladder opportunities. And then the last one, all of these really can help take that cost of constant churn or turnover down. And that's really where the biggest cost lies for us, right? Is around the time and the money and the resources needed to hire and train individuals. So keep that in mind when we're thinking about this. And so to close this out, 3 key areas that we mentioned at the beginning in the webinar in terms of our objectives. Thinking about how we maximize transferable skills and put them to use in healthcare. How we are starting and thinking about offering training programs and the key partnerships that are needed in order to make those successful. And lastly, utilizing career advancement and pathway programs to really retain staff or to bring opportunity to those individuals to do even more in their within their careers. Right. I am so grateful for you all joining today. I know we're a minute over, so we're just gonna give you an opportunity to see if there's any questions. I know we always get are we gonna get a copy of the recording and a copy of the presentation? And yes, you will. We will send that out afterwards. We also will make sure that you guys, once you get that, you'll have the information in terms of like the name of the reports or some of the other, stats that we shared throughout the presentation. You'll be able to see where those come from when you get that information post webinar as well. I will open it up to anyone to see if there's any other questions. I've been looking at the chat.
As those questions come in, please type them into the Q&A. Meanwhile, I did want to show everyone this code. If you want to scan this QR code on your phone, or you can go to this website, which I can put in the chat as well. Please fill out our survey and be entered into a drawing for the $50 Amazon gift card.
Right. I also want to say thank you to our guests today. Jake and Jenna, thank you so much. Both are traveling and in California, so we appreciate your guys' engagement. And I just want to wish everyone else a great rest of the week. And as always, feel free to reach out to any of us at NHA or Ascend Learning if you have additional questions or needs or want to learn more about any of the information shared today. So thank you, everyone. And we'll see you at our next webinar. Have we stopped recording, Helen?